to his brain.
Hi everyone. Oh, sorry. Okay. All right. Hello everyone. So just to let you know, we have combined the 9 a.m. Agenda, those that participated and logged in, and asked them to join us for the 10:30 a.m. agenda for decision making to follow at 11:30. So before we open up the agenda, we have some chair requirements for our virtual requirements that we need to highlight. For those that are testifying, we have a 2-minute testifying time period. You'll be warned, you'll hear a beep on 25 seconds, you'll get a yellow on my screen, and 15 seconds and a red upon the time you at 2 minutes. You then may ask to summarize in 1 sentence, and then the feed will be cut. Remember, we need to adjourn, including decision making by noon. So if agendas go long, we will complete agendas on certain bills, and those bills that are left without a decision making may not be able to be reopened. Please keep your videos muted and your videos off until you are testifying. Zoom chat function will allow you to chat with technical staff only. If you are disconnected unexpectedly, you may rejoin the meeting. In the event of a network failure, it may be necessary to reschedule the hearing. Please avoid using any trademarks or copyright images, and please refrain from using profanity and uncivilized behavior. Heard that, members? Okay, so knowing that, we will be opening the Committee on Health, Human Services, and Homeless for the purpose of hearing an agenda of the 10:30 a.m. for February 1st, 2022. Okay, we again, thank you for your patience. And due to time, we would highly recommend people to rest on their testimony because we would need to end this agenda as quickly as possible to move to the decision making. So first measure, HB 1746, relating to health. We have DHS. Okay, if you do get on, let me know. How about Department of Health?
Good morning, Chair. Keith Ridley for the Department of Health. We stand on our written testimony and are ready to answer any questions. And also please note the requested amendments at the end of the testimony. Technical amendments just for consistency. Thank you so much.
Okay, thank you. Okay. So Department of Human Services, if you do come on, it's the last chance. Provided comments, and Hawaii Substance Abuse Coalition in opposition. Members, okay, last, okay, members, any questions? Okay, seeing none, Chair is going to move on to the last measure of this agenda, HB 1823, relating to Health, Department of Health.
Good morning, Chair. Lauren Kim, Policy Director for the Hawaii Department of Health. The department has submitted comments, and I would like to highlight a requested amendment that makes confidentiality of communications for Our Care, Our Choice, aka medical aid in dying, to strengthen the confidentiality provisions by expanding it to cover everything in the chapter, as well as any incidental and routine communication. We think that is very important. This is a very private matter that is between the patient, their family, and their provider. and we want to keep it that way. Thank you for the opportunity to testify, and I'll be on standby for questions.
Okay, thank you. Board of Nursing.
Thank you, Chair Yamani. My name is Leanne Tashima. I'm the Executive Officer for the Hawaii State Board of Nursing. We'll stand on our written comments only with respect to the advanced practice registered nurses. Thank you.
Okay, thank you for being here. Okay, Hawaii State Center for Nursing.
Good morning, Chair Yamane and Vice Chair Tam. Thank you so much for the opportunity to provide comments. We're available for any questions about APRNs should you have any. Thank you.
Okay, thank you. Hawaii American Nursing Association.
Good morning, Chair Yamani and Vice Chair Tam and committee members. Thank you. I am Linda Beechnor. I'm the Vice President and Executive Director of Hawaii American Nurses Association, the professional association for registered nurses in the state of Hawaii. And we would like to stand on our testimony in full support of this bill. Thank you.
Okay, thank you. Hawaii Association for Professional Nurses.
Hi there, committee. My name is Bradley Kuo. I am the Legislative Committee Chair for the Hawaii Association of Professional Nurses. We stand on our testimony already submitted, and we will be available for questions.
Okay, thank you. Hawaii Pacific Health. Okay.
Wait.
Go
Oh,
ahead.
sorry. Good morning. Thank you, Chair. Thank you, Vice Chair and members of the committee. I'm Michelle Cantillo, Advanced Care Planner Coordinator. I stand on my written testimony, and I also represent Hawaii Pacific Health, and I'll be here for answer any questions. Thank you.
Okay, thank you. Compassion and Choices.
Thank you so much, Chair Yamane, and to all the committee members for hearing the bill today. We are grateful to the Kapuna Caucus for choosing this bill as one of their priority bills. We have been getting calls for the last few years from people who are unable to access the law, both in Honolulu as well as on neighbor islands. And this bill originated from a summit at the end of the first year with clinicians who had supported patients under the law. We recently had another summit with clinicians from neighbor islands as well as Oahu who have supported patients under the Our Care, Our Choice Act, and they continue to recommend these crucial amendments. Right now, healthcare systems, many are doing everything they can, and it's illegal to get patients through faster than 20 days. And most people don't ask for the medication until they need it. And so that's why the waiting period is really problematic. The people who choose medical aid in dying don't want to die. They just don't want to suffer at the end of their lives. And so I'm so grateful for all of the medical providers we've been working with over the years. They are incredible. They took out hours of their time during a global health pandemic to work with us on this bill, to show up here today. It's incredible. And I'm so grateful that you're hearing it. And we encourage you.
You understand that we have a time frame, right, to get through this by 11:30. And
Yeah.
if we're unable to, then we may not be able to reopen this bill, right?
Yep. All right. Thank you,
Thank
Rep. Yamane. I stand on my testimony, and we also support the Department of Health's amendments. Thank you.
Okay, thank you. Aloha Care.
Good morning, Chair Yamane, members of the committee. Taigi Mirza with Aloha Care will stand on our written comments and support. Thank you so much.
Okay, thank you. Hawaii Society of Clinical Oncologists. Oncology.
Good morning, Chairman Yamani and the rest of the committee. My name is Dr. Charles Miller, and I'm here representing the Hawaii Society of Clinical Oncology. And I'm here to urge your support of HB 1823. I want to just focus on 2 points. Number one, the lack of access to the law on the neighbor islands. And number two, the barriers to access with the 20-day waiting period. I have had to personally fly to the Big Island just in the last month to provide medical aid in dying consultations for services both in Hilo and in Kona. And the law would allow APRNs to participate in the Our Care, Our Choice Act, and that would dramatically increase access on the neighbor islands. The other thing is the barrier for 20 days waiting period. I have been the director of the Kaiser Medical Aid and Dying Program for 3 years. I have consulted on over 125 patients who requested medical aid and dying. And I believe I have more experience with this law, with medical aid and dying, than any other physician in the state. And out of those 125 patients, fully 30% of them did not make the waiting period. So 30% of these patients died in the last few weeks of their lives with incredible suffering and fear, because even though they met the requirements of the law in every other way, they simply couldn't survive the 20-day waiting period. And I strongly urge the chair and the committee.
Thank you. Can you summarize in one sentence?
Please pass this bill so that all Hawaii patients can choose aid in dying.
Thank you. Moving on to Craig Nakatsuka. Dr. Nakatsuka. Okay. Anybody? Okay. All right, we're going to move on. In opposition, Mary Ueda. Okay, in support. Okay. Aubrey Hawk. Okay. In support, Mary Steiner.
Sorry,
Oh,
Rep.
Aubrey?
Yamane.
Okay, go
Yep,
ahead.
I'm here. Thank you. I am testifying in support of this bill. I am a resident of Volcano Village in rural East Hawaii. In my role as a volunteer patient navigator, I work to help patients who are desperate. By the time they find me, they have not been able to find a provider to help them anywhere. I have found without exception, these patients who are there suffering and dying, and they have given this matter long and serious and well-informed thought. They don't need 3 weeks to be forced to wait in case they change their mind. They don't need an arbitrarily long waiting period forced on them by the government in order to access medical aid in dying, which is their last wish on earth. And incredibly, believe it or not, the patients who do find, who have a waiting period, they're the lucky ones. They have at least found a doctor who will provide this care for them. Too many patients don't even get that, which is why I believe that APRNs should be given the right to help their patients with medical aid in dying as well, if they already have prescriptive authority. Please pass this bill. Thank you so much.
Okay, moving on to Mary Steiner.
Hi, this is Mary Steiner speaking as an individual who cares deeply in strong support of this bill, and I'll stand on my written testimony. Thank you.
Thank you very much. Nina Buchanan, sorry. Okay, moving on. Kathy Kosick.
Yes, I stand in support of this bill and the testimony that I wrote. And as an experienced hospice nurse in the past, as well as having a family member die while trying desperately to get the 20-day approval through 2 different physicians, unable to do it. By the time she needed enough medication, she was ineligible to go through enough medication to control severe ovarian cancer pain. She was in agony through her death. My sister, my baby sister. Thank you. I'm in support.
Thank you, Kathy. Okay, Leilani Kapahu Marino, Kaho'ano. No more? Okay, thank you. Cindy Coleman.
Okay, I'm here in support of the bill. My brother George passed in November, and we actually had Aubrey Hawk help us. But our greatest fear was that the cancer might go to his brain and he would become ineligible to complete the process. Thank you.
Oh,
I stand in support of this bill.
Awesome, thank you. Okay. Oh, I have you twice, so, okay. Members, we have, let me go through the list and then we'll go to questions if you have any. Okay, we have Hawaii Family Forum in opposition, Hawaii Island Association of Marriage Family Therapists in support, National Association of Social Workers in support, Miley Case Management in opposition, Hawaii Psychological Association in support. We have a number of individuals in support and opposition. So I'll go through support. We have Roberta Fonta, Karen Ireland, Brian Goodyear, Carolyn Kunetake, Kathleen Yokuuchi, David Gilly, Leon Houcher, Marion Purrier, Diane Ware, Thaddeus Pope, Roxanne Ye, Matt Bishop, Stephanie Marshall, Susan Amina, Charlotte Sharfin, Julie Crawford, Leilani, you testified, Robert Junter, Sandra Tolles, Leilani Maxer, Becky Gardner, Planned Parenthood, Hawaii Pacific Health in support, Hawaii Health Committee of the Democratic Party, Cindy Coleman, Brian Ershoff, Carolyn Bitterman, Roxanne Rowe, Jeffrey Mermelt, all in support. Those in opposition, we have Eva Andrade, Gabriela Ortiz Amfaro, Maureen Abe, Becky McPeck, Willie Lin, Dr. Daniel Fischenberg, okay, Hitomi Nakaoka, Neil Shimoda, Kathy Cipriano, Albert Shigemura, all in opposition. Members, any questions? Representative Ward.
Thank you, Chair. I think this is to the Department of Health, for the gentleman whose picture is not on here, who has been in charge of the Death with Dignity. Is the Department of Health here?
Yes, Representative Ward, this is Lauren Kim, Policy Director.
Okay, Lauren, good. I'm looking for some metrics. How's the utilization? What's the, in fact, if I can do a comparison, how many people die every year in Hawaii and how many people have death with dignity?
I believe there are roughly maybe 18,000 deaths in Hawaii, somewhere around there. Those who participated who completed the medical aiding dying process was greater than expected. We compared our original numbers to the state of Oregon, where medical aided dying has been an option for about 20 years. So we looked at the proportion of the population and we originally thought that it would be several dozen, maybe 30, 40. The first year was around that number and it's gone up. We are still compiling the data for last calendar year, but we expect it to be around 70-ish patients who successfully completed the medical aid in dying process. Of those, the vast majority, I'd say 85%, if not more, ingested the medication, and the remaining 15% expired, presumably from their underlying medical condition.
So 18,000 versus, as you said, 70-ish, correct?
Yes, for the last reporting year.
Okay. Do you have a count of how many of those are pending? You know, we keep hearing about the 20-day waiting period. How many do you have now, right now in the 20-day waiting period?
I'm sorry, the department does not collect that data. The way the statute is written, we are legally obligated to complete, providers are legally obligated to submit paperwork for those who completed the entire process. So the numerator of people who are waiting for an appointment or getting through the waiting period is not quantifiable by the department. I would defer to Dr. Chuck Miller, who I also agree probably has the most experience with this in the state. In the Kaiser system, his anecdotal, if not documented records are greater than what I have access to at the Department of Health.
Does Dr. Miller accept your passing of the baton?
Yes. Can you hear me?
Yes, please proceed. If you know the answer to that question, the pending 20-day waiting period, that seems to be one of the big drivers of this bill.
Well, okay. In my experience, in 3 years, 30% of the patients who were referred to me or asked for consultation with medical aid and dying, over 30% of them died in that 20-day waiting period. And there's nothing I could do because it's not legal for me to write that prescription beforehand. I personally would love to see two things. Number one, the waiting period reduced. California now and New Mexico require only 48 hours. And the other thing would be that when I walk in to see a patient, as I told you about the guy in Waikiki, I have enough experience. I've been an oncologist for 50 years. It's very clear this patient is not going to survive the 20-day waiting period. And Oregon and California both allow the attending physician, the one who will be writing the prescription, to waive that requirement if, in my clinical judgment, I believe that patient will not survive 20 days.
Okay, Dr. Miller,
that would solve this.
I know the chair's time limit is limited, especially if I ask too many questions. But I want to follow up with it's, as you know, the poster child was John Radcliffe. Do you know how long John Radcliffe had his medicine at his bedside? It was not there. It was not 20 days. It was probably a couple of months. So my question is, why are some of these patients not counseled? Hey guys, stockpile ahead of time if you're serious about this, or is it because it's such a last minute phenomenon that the 20-day is bumping up because of a lack of planning? In other words, the Radcliffe model was, hey, if you're going to do it, order it. It's like stockpiling. Order it ahead of time. So why is 20 days a problem if you can do the Radcliffe option?
I can tell you just simply from personal experience, those patients, and every patient who makes the decision, who makes the choice of aid in dying, it's a very, very personal and difficult decision made almost exclusively with their families. And many patients just they wait too long.
Yeah,
they just wait too long.
The other question is, obviously you are a physician who does this. How many physicians are not doing this? The accessibility and now wanting to bring in the nurses to do it. How much of an opt-out has the medical profession, your colleagues? What percentage of them do medical aid in dying and then who do not? Do you have a number?
Okay, I believe that the State Department of Health, Lauren Kim has the numbers of actually how many physicians in the state have written. But I can tell you the biggest problem is the neighbor islands. On Maui, I'm aware of one physician who is willing to do this. On the Big Island, there's no more than 2 or 3. Kauai, I think, has one. And remember this, nurse practitioners provide all the other regular medical services on these neighbor islands, and they are specifically forbidden to participate in aid in dying for no good rational reason.
But Dr. Miller, what if their refusal to participate is as high as the physicians themselves, which it makes it sound like it's in the 90 percentile who are not doing it? How do you know the nurses are all gung-ho to do it rather than comparable to their colleagues who are medical doctors? Anyways, that's probably rhetorical. Let me move on to the other question of the average age of those people who are doing the medical aid to dying? And then if they have COVID, I want to get, did anybody get the death with dignity with COVID as a complication?
Chair, I don't have access to that information yet. We're still compiling requests and completed forms during the pandemic, but I will get back to Chair Yamane with that number. I can answer your question regarding the number of, or at least give you an order of magnitude of the number of discrete physicians that have participated, and it's about a dozen. It was 13 in 2019 and 14 in 2020. I also would defer to Laura Reichard of the Hawaii Center for Nursing.
Sorry, Mr. Kim, a dozen what? Participating in what?
13 providers wrote prescriptions for persons requesting medical aid and dying in 2019 and 14 in 2020. In general, there are about 10,000 licensed physicians. Not all of them are active, but there are 10,000 licenses on file, or so is my understanding. As for your question about APRN,
Let me clarify that. 13 have prescribed, but of those who have not prescribed, how many are actually for and participating in death with dignity? Not those who have actually done it, but those who are capable and willing to do it.
I can't answer that again. The law only requires physicians who have completed the process. Okay. So the entire denominator is an unknown quantity to us because those providers are not compelled to submit paperwork to the department.
Chair Yamane is just giving me a signal. Okay, that's the end of your questions, Ward. Okay, Chair, back to you. Thank you.
Thank you, Representative Ward. Any members have questions? Anybody online? Any chair? Great. Okay, so we will be recessing and reopening this agenda following the decision making for the 9 a.m. agenda on this feed. So we will be in a brief recess. Thank you. decision-making purposes. Okay, members, first bill, HB 1667 relating to health. The recommendation of the chair is to move this measure as an HD1. We're going to be incorporating the amendments that were submitted by a number of them, specifically the ones presented by Sanhai. We need to make tech amendments, and we're going to be putting in an effective date of 7/1/2060. So members, any discussion? Okay. Okay, seeing none, Vice Chair?
Voting on House Bill 1667, Chair's recommendation is to pass with amendments. Vice Chair votes aye. Chair?
Aye.
Rep. Gates?
Aye.
Rep. Har?
Aye.
Rep. Capella?
Aye.
Rep. Nishimoto?
Aye.
Rep. Ward? Chair recommendation is adopted.
Thank you, members. Moving on to HB 1679 relating to acupuncture. Members, the recommendation of the chair is to move this as an HD1. We are going to make the recommended change regarding the use of the word physician. We will change that to doctor, as noted in the testimony. Members, the Board of Acupuncture, DCCA, also recommended changes of the implementation dates. We will incorporate that into the measure. We also have technical amendments, and we will put in a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1679, Chair's recommendation is to pass with amendments, noting all members present. Anyone voting with reservations? Anyone voting no? Chair, your recommendation is adopted.
Thank you, members. Moving on to HB 1892 relating to the Department of Health. Members, the recommendation of the chair is to move this pilot project forward. We're going to incorporate the various friendly amendments suggested. We're going to change the word elderly residents to seniors and rural residents. We'll be putting in language that was coordinated at least in discussions with Department of Health regarding the potential using this funding for the pilot program to assist records for digitization, to assist seniors and rural residents for electronic access to a specific subset, specifically for assisting Kapuna with things like birth certificates, death certificates, marriage certificates. We're gonna put in 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1892, Chair's recommendation is to pass with amendments, noting all members present. Any reservations?
Okay, members, moving on
Any
to.
no's?
Oh, sorry.
Chair, your recommendation is adopted.
I apologize, I was getting excited. Okay, moving to HB 1783 relating to pharmacy benefit managers. Members, there was a lot of testimony with various concerns with the language of the bill. We'll need more time on that. We will defer this measure at this time. Moving on to HB 1575 relating to physician assistants. Members, the recommendation of the chair is to move this measure forward as an HD1. We're going to include the language as requested, a section that the HAPA, Hawaii Academy of Physician Assistants offered to add that section 10, which is the order of occupational therapy and plans of care. We need to put in some technical and clarifying language, and we will put a 7/1/2060 effective date. Members, any questions? Okay, seeing none, Vice Chair.
Voting on House Bill 1575, Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any no's? Chair, your recommendation is adopted.
Okay, thank you. Moving on to HB 1893 relating to the Oahu Regional Healthcare System. Members, the recommendation of the chair is to move this measure forward as an HD1, noting the fact that the Department of Defense, as well as Department of Oahu Region and Department of Health have been in discussions. We're going to be putting in the recommended amendments submitted by the Office of Veteran Affairs, as well as the clarifying language that was suggested by the HHSC amendments as supported by the region. we need to make technical amendments and use a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1893, Chair's recommendation is to pass with amendments, noting all members present. Any reservations? Any noes? Chair recommendation is adopted.
Okay, moving on to HB 1675 relating to medical care for minors. With discussion with the author, the Vice Chair, we will be just making some technical amendments and a 7/1/2060 effective date. Members, any discussion? Okay, Vice Chair.
Voting on House Bill 1675, Chair's recommendation is to pass with amendments, noting all members present. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you, members. Moving on to HB 1894 relating to human remains. Members, the recommendation of the chair is to move this forward as an HD1. Members, the chair has been working with this and other parties throughout the last 6 months. We're just going to make a technical amendment language, I don't know if HMS will call it minor, but technical amendments and 7/1/2060 effective date. Members, any discussion? Okay, Vice Chair.
Voting on House Bill 1894, Chair's recommendation is to pass with amendments, noting all members present. Any reservations? Any no votes? Chair, your recommendation is adopted.
Okay, thank you very much, members. Moving on to HB 1594 relating to the Center of Nursing. Members, the recommendation of the chair is to move this measure forward as an HD1. Members, we're going to delete a lot of this preamble, starting from the lower half of page 1, cutting out page 2, primarily page 3, and the top of page 4 to make the bill appropriate to what its intention is to do, which is the purpose of this act. Members, we're going to then be making some technical amendments and putting a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1594, Chair's recommendation is to pass with amendments, noting all members present. Any reservations? Any no votes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to HB 1795 relating to health. Members, the recommendation of the chair is to move this measure forward. We will be taking the intent submitted by the both Department of Health and JAPSUM. We will be making sure that the JAPSUM, this bill will not impact the current system and program that's been successful with the University of Hawaii JAPSUM and UH program. So we will make this a separate process. And any reference, so yeah, we want to support that. And we will be making some technical changes where there might be overlap with entities that are not designated in support as part of the loan repayment program. Okay, we'll put a 7/1/2060 effective date. Members, any discussion?
Chair?
Okay, seeing none. Yeah, who's that?
Sorry, Chair. I just have a quick question.
Yeah,
So I
sure.
just want to be clear then, this is a separate program altogether. It's not actually expanding the health core program and the rural healthcare provider loan repayment program. This is going to be its own separate program.
Yes.
Okay, thank you, Chair.
After meeting with some of the legal minds, and that it would be better and for the preservation of the JAPSUM program to make it separate.
Wonderful. Thank you, Chair.
Okay, thank you. Members, any other questions? Okay, seeing none, Vice Chair.
Voting on House Bill 1795, Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any no votes? Chair recommendation is adopted.
Okay, members, moving on to HB 1514 relating to birds. Members, we had a healthy discussion, talked with several other members. There are some concerns. I think we might need to work on this a little. So at this time, the chair is going to defer this measure. Okay. Moving on to HB 1758 relating to nurses. Recommendation of the chair is to include the Board of Nursing amendments into this measure, which is a friendly addition of territory or a foreign jurisdiction on page 5, line 4. Members, any discussion? Okay, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1759, Chair's recommendation is to pass with amendments, noting all members present. Any members with reservations? Any no votes? Chair recommendation is adopted.
Okay, thank you. Moving on to the last measure of this agenda, HB 1579, relating to the Department of Health. Members, the recommendation of the chair is we will, let's see, we going to include the name change as recommended to match that Department of Health will be doing, continuing to monitor the or be in charge of the transfer. We're going to ask, in this, it asks for an extension of 1 year in which then the new administration can come in and explain to the legislature the process and progress. We're going to ask then, put in language for a second report, 20 days to the following, so the 2023 session, to provide us a full update on its progress moving forward in regards to the transfer. And we're going to put a 7/1/2060 effective date. Members, any discussion? Okay. And then we are going to, clarify that there was a request by OIP to regarding questions of confidence of why the sunshine might not apply. We did want to highlight the fact that due to the fact that the board will be discussing not only potential bidders with confidential and proprietary information, but also will potentially be discussing specific client case information. So we want to make sure that remains protected. Okay. So members, the recommendation is to move this as an HD1. Vice Chair.
Voting on House Bill 1579, Chair's recommendation is to pass with amendments, noting all members present, any members with reservations. Rep. Ford votes with reservations. Any no votes? Chair, your recommendation is adopted.
Okay, you guys are all awesome. Thank you. Ending that agenda. And then we're going to reopen the agenda. We're going to be reopening the 10:30 agenda for the Committee of Health, Human Services, and Homelessness for February 1st, 2012 for 2 measures. Members, first measure HB 1746 relating to health. The members, the recommendation of the chair is to move this forward with Department of Health's amendments, some tech amendments as recommended by HMSO, and a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1746, Chair's recommendation is to pass with amendments, noting all members present from the previous hearing, any members with reservations, any noes. Chair, your recommendation is adopted.
Okay, thank you. Moving on to the last measure, HB 1579, relating to the Department of Health. Members, thank you for your guys' patience. The recommendation of the chair is to move this measure forward as an HD1. Oh, wait, what? Oh, sorry. Wrong agenda. Sorry. We're moving on. So let me reboot. Okay, we're moving to HB 1823 relating to health. Okay, the Kapuna Caucus requested bill. Members, the recommendation of the chair is to move this measure as an HD1. We're going to be making some changes and additions to the measure. Members, we're going to make it so that it's APRNs and physician assistants, okay? And make it clear that it's APRNs. So it means certain references to mental health nurse practitioners or clinical nurse specialists, so long as they are an APRN, we'll make it sure that it's related to their degree as an APRN or PAs. Members, we're also going to include some of the recommended changes from Department of Health for the monitoring. Okay, members, also during the look into this last year during the off session, the delay in the implementation, which this bill allows for 15 to 20 days, has been determined that sometimes the delay is due to the fact that these patients are unable to get appointments or meetings or evaluations by the three recommended individuals. So the chair will include that if a patient is unable to get to the three providers within 10 days of their initial request, then their waiting period will be now 10 days rather than 15. Okay? And then we will be putting a 7/1/2060 effective date. Members, any questions? No? Okay. Seeing none, Vice Chair.
Voting on House Bill 1823, Chair's recommendation is to pass with amendments, noting all members present. Any reservations? Any noes? Rep. Ward votes no. Chair recommendation is
I'm
adopted.
sorry, Mr. Vice Chair,
Rep. Har.
with reservations, please.
Okay, Rep. Har votes with reservations.
Thank you, Representative. Anybody else? Okay. Thank you, and we are adjourned.